We should be listening to what our bodies are telling us about what's happening in our environments, because if we feel there's an injustice, our bodies are often right, and we should listen to that. And one of the goals in social prescribing is to have the system, the people working to support you, really listen to that and respect that too. And that's the part that's often missing in our encounters with healthcare. I think from my perspective, it would be allowing the body to lead, and to be respectful of the times when we need to step back, be respectful of the times when we need to self-advocate for, a different due date for our assignment, recognizing the times when we just don't have the capacity to meet all the demands that are placed on us at any given time. In a sort of capitalist, productivist culture, there's a lot expected of us, and it's not always entirely reasonable. And most people don't know what all the different demands are on any of us at any given time. And so listening to our bodies is partly a way about managing all of the different kinds of expectations on us in a way that we feel is sustainable and humane. And so that's what, when I think about sustainability, I'm not just thinking about can we afford something, or can the environment continue it, but can we keep it up? Can we really keep doing this? And I'm a parent of young kids, so I ask myself that all the time. And I haven't always been particularly good at it, but for me, the pandemic time has been an important reminder about where my limits are and how to start saying no to things. And that really comes from the body, who, can only do so much. Again, our society isn't structured to give us that time. We have semesters that proceed apace on sort of an industrial schedule, whether we're ready for them or not, whether there's a pandemic on or not. And you may have a very lovely relationship with your classmates and professors and help find a way to navigate that together. But there are still some sort of preset timings about things. And, that is part of this colonial. It's what we've inherited from colonial and industrial times. It doesn't necessarily serve us. And so it is a political act, again, to kind of think about that and to say no where we can, and to find ways to say no together, which makes it, again, easier and more effective when we can. So I think it's quite radical, actually. Yeah. And then for people who are socialized to please others and go along, and as women, for example, we're socialized to just accept all kinds of demands on us and be quiet about our own body's demands. You don't necessarily hear often about your peers' menstrual cycle, even though they might be very tired at a particular moment and very energized at another particular moment that have nothing to do with any of the external demands. That's part of listening to the body, is just being aware of your own biorhythms and your own sleep patterns and all those kinds of things. And thinking about, if you're thinking about creating a healthier new world, being aware of that and respecting that in yourself is really important. And we see real leadership on this from Indigenous and Black communities, for example, where, being able to tap into other traditions is a reminder that there are other ways of doing things. We don't have to do it this way all the time. And maybe there are transformations that we can make, but it really starts by recognizing where we might be able to root those.